very good evening to all. Homeopathy is a holistic system of medicine. Homeopathy is an art of science. The science of homeopathy and the laws and the principles on which homeopathy is based. Homeopathy is an understanding of the patient, under evaluating the details and applying the laws and principles in each case. So we have Dr. Navnit with us, who will be throwing some light on homeopathy. Welcome, sir.
Thank you.
So, my first question to you is, what do you feel is the most gratifying for you as a professional and medical practice, teaching, writing, or research?
Yeah, these different areas are connected with the same field. But personally speaking, I like to be a clinician, the medical practice through homeopathy, and then comes the teaching because a good teaching is based on a good clinical experience. So to be a good teacher, you need to be a good doctor first. So if you are not a good clinician, then to be a good teacher, it's a difficult thing. But the core of every aspect, be it a researcher, be it a teacher, be it a writer, whatever. But to be a doctor first, it is a very essential thing. And I like to be a doctor, and I like that I'm practicing homeopathy and helping patients with homeopathy in a core of this all other activities.
Mm.
Yeah.
So, what are the challenges you faced in your 11 years of homeopathic experience? What was your approach in order to overcome those challenges?
See, if we speak about the different challenges in clinical practice, by God's grace, I had support of my family who supported me to pursue my vision and to be a homeopathic doctor. So on that front, I had a good support. But at a particular level for a homeopathic practice, so there were different challenges. Speaking, if you start your homeopathic practice, so it is important where you are practicing. The knowledge of homeopathy in the community, awareness of homeopathy in the community, so they can directly approach you or not, whatever. And the individual practice, when you are doing individual private practice and not doing a job, so that's another challenge. Another thing is, when you start your practice, you are just a beginner. You have studied a lot, we have a knowledge, we have some experience during our training, but as a professional level, we have just started. So these were the issues when I started my practice. I tried to follow my vision to be a good homeopath, and I focused on practice, tried to update my knowledge through my own experience as well as through other colleagues' experience, and and different studies in the field, and the consistency. So these all things helped me to overcome those challenges which I faced in the initial days of starting my practice. Yeah.
Consistency remains same in all the fields.
Yes, definitely. So it is actually a general thing, be it a homeopathy or other field. But to follow your vision and to be consistent in your efforts, that helps in a much better way.
Hmm. So, what was the inspiration behind choosing homeopathy as a field to expertise in?
So honestly speaking, when I passed my 12th, when we just choose in which stream you are going to get admission, so I was not clear at that time. Somehow I got admission in homeopathy. So I was not clear about the professional area where I am going to work. But when I started to study in our syllabus or in my college days, the study of homeopathy, the principles, concepts, experience of homeopathy was so much fascinating. So in the second year, I decided to be a homeopath and to practice homeopathy only. And then afterwards, seeing our teachers and other doctors to treat patients, to helping patients with their complaints through homeopathy, And when I was in my UG and especially the PG days in one of the most uh, good college, Dr. Dhawade Institute. So I had a chance to witness a lot of help homeopathy is doing at a many front in OPDs, in IPDs, in community, and different departments. So witnessing those effectiveness of homeopathy, those in those areas, inspired me that I should pursue this line further, and it got intensified by each experience and my teachers definitely. Yeah. So I decided to follow the to practice homeopathy uh, in this way.
So,
Yes,
can you please elaborate upon how homeopathy is healing science of tomorrow?
healing science of tomorrow.
Yes.
Futuristically, for future perspective, if we see, so homeopathy started as a science or as a new science 2 centuries back,
Mm,
and now it has been spreaded all over the world.
mm,
Why it should be called or it should be viewed as a healing science of tomorrow? There are different reason or there are different areas through which we can see it. One is clinical side. Um, we can see a lot many problems with the patients or in health sector that there are a lot of challenges are coming up with the modern medicine. If we see allergies, if we see autoimmune diseases, antibiotic resistance, and lot many things, where allopathic medicine or we can say modern medicine is not helping much. And at that front, homeopathy is a good option. And in other lifestyle diseases and chronic disease also, homeopathy is giving good results. So this is one thing. Another point is nowadays different governments started taking homeopathic as a system of medicine seriously. Even our Indian government has included homeopathy in the Ayush ministry, and in other in European countries also. Some government, like I think Swiss government, has also included homeopathy in its health policy also. So there are a lot of policy which includes homeopathy. And about community, if we speak, so if we consider the scenario of knowledge and awareness in community about homeopathy, today is a much better condition for that. I started practice in a decade ago almost. So I'm seeing a lot of people are getting aware about homeopathy, its effectiveness, where it can help, and even the internet and social media is also helping in some way to spread about knowledge of homeopathy. So we are seeing homeopathy as a growing science, helping with a lot of health issues. So in this way, we can see as a healing science of tomorrow. Yeah,
So, homeopathy has a lot of scope in terms of growing in future.
yes, definitely. So there are different aspects for the growth. Homeopathy has grown in a much better way in last few years. So there are a lot of colleges are being opened. There are a lot of positions, and people are also choosing homeopathy for their health problems in a much more way than before.
Mm. So, could you please elaborate?
Yeah.
Mm, yeah, sorry, no, sorry. What are your plans for contribution to the development of homeopathy?
So development of homeopathy, if we see, is a much larger work.
Mm,
So one person alone
mm,
can contribute a little. So there are many avenues in which we can contribute. Clinical side, community side, teaching side, research, as well as even policy making, institutional level. So I am seeing myself as a clinician and a teacher, not as a entrepreneur, right? So you can be entrepreneur being a homeopath also, but to have a clarity what you can do and what you are not. So it will give you a clear vision how you can contribute. So I'm trying to teach more and more student for a practical part of homeopathy where they can directly apply the knowledge of homeopathy in their practice. I'm trying to teach or trying to mentor students and a fresh homeopaths who are trying to set their own practice. This is one aspect. Another thing is I'm trying from my very little effort, we can say at my level, um, I'm trying to share my valuable experience from my clinic with, if possible, with the evidence to share it as a research article or some case report and for the publication to writing it out. So this scientific writing is also one way to contribute for the development of homeopathy. So I'm seeing that as my part of contribution to the development of homeopathy. And of course, helping patient through homeopathy is the core of all these things. That remains the consistent.
Okay. Okay.
Yeah.
So could you please elaborate upon on how do homeopathic medicines work, and can homeopathic treat chronic diseases and long standing standing diseases?
I will give answer of the second question first, and the first question in a second step. Homeopathy can treat chronic disease and long-standing disease. Actually, homeopathy is known for that. Most in the most of people, and even in other doctors of modern medicine, homeopathy is well known for its effect in the chronic disease, be it a long-standing skin disease, or be it allergy since last 5 or some years. So we are often getting this type of cases more than other type of cases. So it is known. So it is known
Mm.
for its effect on chronic disease. So definitely homeopathy can treat chronic disease. And the first thing, how homeopathic medicine work. See, basically, homeopathic medicine are prepared from different sources from nature,
Mm. Mm.
and we process it out, and we call it potentization. So this is how homeopathic medicines are prepared. That we have all the list of the symptoms which are covered by that particular medicine.
Mm.
Being a science or being a holistic science, homeopathic doctor focuses on the disease as well as the person who got the disease. So we study the whole patient in its entirety.
Mm.
What are the symptoms of patient? What are the symptom of disease also? And we treat each patient individually because be it any disease, the response pattern of particular patient is different than others, whatever may be the disease. So we try to understand patient's response system, its immunity, its susceptibility, and all the different things. I'm not getting into the technical details, but and we try to balance or will stimulate the whole body system in a way, or we can say in a curative way, that body system gives a curative response to the disease, or it naturally heals the disease, and it directly does not attack symptom or directly does not suppress the symptoms, but it prepares the body, it prepares the individual to fight the disease in a natural way. This is a simplified version of the how homeopathic medicines are working. So this how homeopathy medicines work for a patient, be it any disease. Yeah, I hope it is explainable. It is understood.
Yes, yes, you have explained it very well that now I can relate to homeopathy more than as compared to allopathy.
Yeah,
So,
yeah,
what is the
fine.
thing that what is the things from modern medicine that homeopathy principles can apply?
Apply.
Yes,
I think you mean what are the things from modern medicine where homeopaths can allow those things.
yes.
As far as there are lots of development in the modern medicine as
Mm.
well as in homeopathy.
Mm.
First, I will try to answer what
There are lots of development in the field of modern medicine as well as usually, or homeopathic principles don't allow suppressive measures by their principal side of view. But usually don't have any problem when you have some deficiency in your system and you are taking supplements. That's see homeopathic principles have no problem where if we speak on a brief in brief. So if a person have some deficiency in his body system for some particular nutrients, so to take supplements for that is okay with homeopathy. But we don't allow the suppressive measures which attack directly symptoms or which suppresses the symptoms and not curing the disease. Those type of treatment we homeopathic principles usually don't allow as a system. And in certain we can say muscular diseases or joint diseases or orthopedic conditions where the inclusion of physiotherapy included with homeopathic treatment is a good option. So from that angle, including physiotherapy also helps to recover better, including with homeopathy. In certain cases, not in every cases, but in certain cases where the organs are not producing properly, not producing hormones at all, then the to take hormones as a supplement, it becomes an essential system. So these are the very we can say commonsensical things which homeopathic principles have no problem with that. And speaking about surgery and emergencies, they are altogether a different thing as far as the true surgical cases are concerned. So the reason becomes the mechanical one, then the surgery is of help. So homeopathy seeing surgical cases as a surgical one, but there are some so-called surgical conditions where homeopathy can better help sometimes. Or we can say the option in modern medicine is surgery, but homeopathy has a solution with the medicine. In those cases, we can avoid surgery in certain cases, and in actual surgical cases where the surgery is essential, so that's okay with that. I think I'm clear for that.
Yes, sir, you are.
Yeah.
So, as a
Fine.
homeopathy physician, you have focused on allergies, skin-related problems, etc. So, what has been your approach while curing different diseases?
So the as far as at a grand level, the approach to cure any disease remains the same as far as homeopathic principles are concerned. But I'm not going into detail. If I speak about how I treat a particular case of allergy and how which approach helped me to cure that, that would be a more technical from homeopathic subject side. I will not speak into that. But at a general level, I'll try to help patients. And some points are in my mind while treating these cases. So I will try patient approached me. What are his expectations? And what I can help with, and what is the role of homeopathy in his condition or the stage at which he approached me, and what can person do from his side apart from taking homeopathic medicine. So these are the different points which I try to clear out during the visit, and I try to help with homeopathic medicine. And even there are some suggestions apart from homeopathy about lifestyle changes, sometimes some counseling, sometimes the patient's approach to some particular work or their some particular things needs to be modified. So in that way also, wherever I can help, I try to help patients apart from homeopathic medicine also, besides homeopathic medicine also. Yeah.
Perfect. So, having an expertise of 11 years in the field of homeopathy, would you like to tell our audience about how a person can take care of their allergies naturally at home, like me?
If we speak what is allergy, actually we try to get some tips to control the allergy. But if I will answer directly also. But first we need to understand what is allergy. allergy. Allergy is basically our hyper response of, it's an over response, we can say, of our immune system to some particular factors. Those factors can be particular food also. Those factors can be dust also. Those factors can be a temperature change also. So where the normal person does not give over response, the allergy patient's body gives the over response to the normal factor. This is the problem with allergy patient. So basically, at a very simple level, you should try which factors are affecting you, and you should try to avoid them. This is the first thing. If you can't avoid them, or if you can't find them, the best way is to treat your allergy with homeopathy. This is my view. Another point is to prevent the allergy, or to prevent triggers. Try to avoid excessive exposure to certain type of particular food or dust, pollutants, and follow the positive lifestyle, regular diet, regular sleep, good sleep, exercise, and all. This will help to balance your system in a natural way, and it will help. Sometimes the different, we can look at these things in another angle also, where you are having not regular good sleeps, your diet schedule is irregular, you are overexposed to some particular type of food, you are eating outside junk food a lot, you are having some particular sort of food in a much excessive quantity. These are all factors, or stress, even stress also. These are all factors which contribute to production of allergy, or not to cure allergy. So try to avoid all this. And meditation or pranayam sometimes help in balancing the system also. But the best way is to treat your allergy with a proper a professional. But try to avoid not getting into the excessive exposure of particular allergen. This is my suggestion for that.
And here